Hi, everyone. Good afternoon. This is Geovani from Reproclinic Barcelona. It's a pleasure to have you today here. I know that we're going to have a little chat regarding egg freezing. Before starting, I would like to introduce myself. As you already know, I'm Giovanni. Um, I'm a specialist in let's say, in vitro fertilization, egg donation, egg freezing treatments, all of this regarding IVF. I'm working in Barcelona, helping many types of patients. I speak 6 languages, and of course, this helps me to, let's say, figure out all the things that I could do for them, also provide them with all the information. Most of the people, most of the time, need to, understand everything that is regarding the treatment itself. So yeah, it's a really important thing for me. It's a really important thing for us. And today, we have the opportunity to at least explain you a little bit more about how we do things here, and also explain you a little bit more about how the egg freezing works. So if maybe we can try to get deep into the presentation that I just maybe would like to give you a few more ideas of how we do everything here in Reproclinic, also how egg freezing works, what things you should have in your mind when you're going to do this procedure, and also which are the factors that may be important to consider before starting. So let's start. Fertility preservation, this is a treatment that is more or less directed to people that would like to preserve their fertility for a few more years. As you know, this is a security of the future that you would like to have for your eggs, for your fertility in general. And also it gives you many options to future treatments and keeping the quality that is really important in, let's say, IVF. So first of all, I'd like to explain a little bit about the process. Okay, this is something that most of the time people ask me how delayed it could be. How many times do I need to be in Barcelona? Which is the exact timelines for everything. So I think this is really important to understand before doing anything. Here in Reproclinic, I think it is really important to have an idea of how we're going to do the treatment itself. So most of the times what we organize is a first consultation with one of our specialists. The main objective of this consultation is to at least provide you with all the details of the treatment and also understand much better the case, understand much better how we could proceed with the treatment, and also, let's say, understand which is the best protocol according to your specific medical case. And our specialists are really well studied professionals that can provide you with all the information about this. And also they've been doing plenty of these treatments with many patients in diverse parts of the world. So yeah, it is a really important thing for us. The second thing is once we've done everything that is regarding the test that we might need to have, also everything that you will have to provide us before starting, then we can start with the treatment itself. What does this mean? So the medical part starts with your cycle. Okay, most of the times we try to use it as a general idea of when we'd like to start, and it's also the main important let's say point of this treatment, because then we can forecast when you're going to be able to do the egg retrieval. So according to this, then we will send you a few things that you will have to do, some ultrasound, some blood work, and definitely the hormonal stimulation, that it's most of the time something that many people ask about. And this is something that, let me be honest, there are plenty of questions regarding this part, and I know that many of you also think about it most of the times when they talk to you about this procedure. But I need to be also honest, and I don't consider that this is something that you need to worry about. Okay, we've got plenty of people from different parts of the world traveling from different continents and countries. So this is something that must not be something to be worried. We have plenty of options to provide you with all these ideas, and also plenty of opportunities to see how we can proceed with this. So in this case, I don't think it must be something necessarily important to think about, because there are many options we can offer you. Finally, once we've done all this procedure of studying how you are prepared, how the simulation is going, the blood work, the ultrasounds and everything, then we will proceed with the egg retrieval. What's this procedure itself? It's a intervention, okay? It's a little surgery that we perform to take out the eggs, as we've seen that your ovaries are ready. And then what we do is basically to prepare everything in the surgery room, and then you will be sedated. You don't have to worry about anything. This is only to relieve a bit the pain. And then finally, it will be around 20 minutes procedure that you will be totally feeling well and safe. And then our nursing team, they will take you to rest a bit. Then you will constantly be monitored and see if everything is going well with your vital signs. And finally, once you've already recovered, then they will be with you to come and see the doctor. The doctor will comment you the result of the process, and if you have anything to talk about it regarding your general status, if you have any pain, if you would like to ask something about the results that may be concerning for you, then this is, let's say, a moment to talk about all of these things. Finally, you will know from the laboratory which is the vitrification part. The vitrification part is something that is really important, because most of the times the result that we can obtain from the surgery is not exactly what we are going to freeze. So this is something that if you have any questions, if you have any concerns, definitely our lab team can also explain you about it, or even the doctors can give you a general idea of how it works. And in, let's say, basic terms, this is the moment where we are going to actually preserve them. So it is really important to understand how everything works. Most of the times, this is a procedure that is really quick. And as I said at the beginning, we have everything already well prepared. We've been working with this procedure many times, and it is something that we definitely know how to do. Okay. Then, well, this is a general idea of how the medical power is gone, as I said. Well, this is also, it has some ideas of how you have got to do, let's say, the hormonal stimulation, where you're going to start with the ultrasounds, and then how many times you need to be in Barcelona, how many times you need to do the ultrasounds. This varies according to every patient. This is something that I always like to point out with all of my patients. I always tell them that most of the times we can have around 2 to 3 ultrasounds, but this is something that, medically speaking, we cannot forecast, because it depends on your situation, and we would never tell you something that can make you feel uncomfortable. And of course, let's say that main idea is to give you the best result. So our concern and our objective is to provide you with everything that can be comfortable, that can be suitable for your medical case, and also that can make you have the best result at the final stage of the procedure. So in this case, as I said, this is a general structure. And yeah, most of the times, this is a really easy thing that we can just organize step by step according to how we see the ultrasounds. If you would like to do in your country, if you'd like to do it in Barcelona, there are many options to do it, and everything is already possible. So I think it's really, really, really important to point this out again. Also, in our clinic, as many of you may know, and also I would like to talk about this, we offer a really holistic support. This is a really important thing, because we just not only consider that fertility treatments are about, let's say, physical health. It is also about mental health and general health that can be assisted by many of our professionals that also work with us. We offer some services such as acupuncture, psychological assistance, and also some fertility coaching. Some of our patients are really interested in having some options about how I can use this act in the future. So this is something that can be a little bit stressful most of the times, because there is a lot of pressure about how I can do this procedure. When do I have to do it? Am I in the correct age to do it? And as I said, as a patient assistant, I always bring these ideas and these answers to all my patients. I think this is really important for people to know that there are different cases. There is not general rule about how we can do it. Of course, there are many studies. There is a lot of literature about age, fertility, how we can do the treatment, many approaches for enhancing the results. And of course, this is something that I think is really important to understand, that apart from all these things, we also need to think about general health, that it's also let's say adding the mental health, every support that you can get also from other people that has already done it. So in this case, as a holistic clinic, we consider and we believe in the services as something that is really important also to offer. We've got many patients that they ask for it, and we've already offered it, and they feel really relieved when they know that we also have the services. So yeah, this is a really good proposal for people that can need it, and that can definitely ask for it anytime that they feel they would consider about it. So in this case, I would like to say that sometimes it can be a bit tricky about how many cycles I need to do, how I can, let's say, engage this idea of preserving my fertility and freezing my eggs with all the things that people have told me, with all the experiences that my friends have. So I would like to just mention a bit about, because there are many answers about how many eggs, how many things I would need to have. So before going with all the things regarding like the cycles itself, I would like to answer something that is really asked many of the times. Let's say that the number of eggs is something that can vary in each patient, but most of the times what we always ask is around 15 eggs. Okay, this is something that can give us a really good chances of in the future having a good pregnancy and also having finally a baby. So this is something that is really important to understand. The expectations of how this can be vary in every age range. Okay, this does not mean that if I'm 38, if I'm 35, if I'm even 30, if I'm 40, this can be different or this can be a rule. It is not like that. In Reproclinic, we all the time we consider every factor that we can. We study a lot of parameters to see if there is something else that we can at least do. And of course, we always try to, let's say, approach the opportunity to give you as much preparation as we can. Let's say that most of the times the preparation can include some exercise, also health, let's say diet, or even some supplements that can help you to maybe get relief. Also some of the ingredients that has been proved in the literature that can help you to improve your egg quality. This kind of things can be really interesting also for many of the patients. So yeah, I think it is really necessary to talk about all of this. And in general terms, there are different types of patients, and I definitely propose you to ask us if you'd like to have a first consultation. This is something that can be really useful most of the times when you have many questions and many things to ask. One of our specialists can definitely be really into helping you, so no worries about that. Proceeding with the presentation, I would like to just comment to you a little bit about how we distribute it here in the clinic. I know most of the time some people ask if it's a really expensive treatment here in Spain, if it's really different from every country. So in this case, I would just like to make a few points about this. So at least here in the clinic, a single cycle of fertility preservation costs around 2,390 euros. This is something that includes everything that I've been talking to you. Unfortunately, here in Spain, most of the times people ask me, oh, can you deliver the medication? Can you give this kind of things? Well, this is something that is more related to the pharmacy. So what we always do is two at least. give you an idea of how much it costs. And of course, we've been working with many pharmacies that we know, that they know that we send them many times people that want to have the medication. So it is not a problem for us to just have a call, ask them if they have stock or something. And of course, as I said, as we know many of them, we can definitely ask in case there is an issue or there is any out of stock at that place. As I said, we offer you different packages of egg vitrification cycles, because we know that it can be different according to every patient. It can be different according to every medical case. So in this scenario, we've got different packages that we can offer you. Don't hesitate to ask if you have any questions regarding any of them. And of course, if you would like to maybe have a better idea of how it works, also, what does it include? What does it mean in general? Just give me an idea of how it is. Don't worry, we're here for that, and we can provide you with all the details about it. And in case there are many questions, you can always reach us. Okay, then for the next thing, I would like to talk about storing them. This is something that will be a future idea once you've done the treatment. This is a thing that many of the patients also ask, because they would like to know, okay, so after I do all this procedure, what you're going to do with my eggs, basically. And many of the times they ask us about how we store them, how this is not mixed sometimes, even with all the things that can be heard. And at least I can tell you that we, most of the times and every year, we do some checklists, and also we do a stock revision of all the things that we have. And this is something that the administration most of the times contact the patients to give them an idea of everything regarding the material, if they would like to ask about something that they didn't remind, or something that can come up about the pricing, or about if I would like to transport my eggs, if I would like to move them to another country out of the EU, inside the EU. All of these things can be an idea. So in this case, this is something that I truly, let's say, encourage you to ask us, because it is something that can come to your mind when we're talking about this type of treatment. And do not hesitate, that it can be a really easy procedure in most of the times. But of course, we need to be aware of which is your idea for them. And then finally, according to this, as I said, we've got different options also for storing them for the time that you would like to have them here in the clinic. And then once you decide to continue with the treatment, then we can offer you plenty of options. And if you would like just to maybe use them in a really long future, then you can also know that we have options for that. Well, this is more or less the payment structure. As I said, we've got different ways of approaching the treatments with the different packages of cycles that we offer. But this is the main idea of how we, let's say, do all the procedure in the administrative part. I'm a really well-known person for this. So let's say that we always start with the first part of the treatment, that it's an initial deposit. With this deposit, what we do is just to organize all the treatment that most of the times the patients ask in order to proceed with medication, also instructions, prescriptions, any tests that they may need for hormonal levels, ultrasounds, etc. So this is something that my colleagues, also part of the medical team, they can definitely provide you with. And then according to every step of the treatment, then we will always inform you when you will have to do the next payment, if you would like to have any idea of the services that you were asking, etc., etc. So we also have many different ways of paying. Payments are accepted in many ways, even if it is sometimes easier for some patients to do some kind of things. So we always offer all the options in case they need any different thing. So according to this, then we can more or less try to see how to perform everything. Then this is the last part. I would just like to, let's say, give you an idea that with all this information that I just provided to you, our main objective, as I said at the beginning of everything, is that we would like to make you feel comfortable, make you feel understood, and finally that you can at least have in mind that we will always try to get the best results from this treatment. This is a treatment that many people is really well interested more and more every year, because it is something that, let's say, there is a lot of info, there are a lot of videos, there are a lot of media talking about this. So it is really important for us to, let's say, make you understand also how it works. Apart from all the things that we can do here at the clinic, that of course we always offer to you, our doors are open for you to get us your questions, and we are really flexible. We have a lot of transparency in our processes, and definitely you can have a peace in your mind that if you would like to perform this treatment with us, you can do everything in the way that you'd like. If, of course, in the let's say, in the timelines, and also with all the things that it includes and it involves. So yeah, I hope that at least you can have a better idea of how it is. And finally, if you have any questions, you can reach me, you can reach any of my colleagues. We're always open to all of your questions, and we have a really multilingual support that can provide you with different answers in different languages, and we will always try to help you, even if we cannot, let's say, speak the language itself. Okay. So in this case, I think the presentation is already finished. I would like to get your questions. If you have more ideas about when you'd like to do it, when how you would like to do it. If I'm in the US, if I'm in the UK, I'm out of the EU, does it have any important, let's say, weight in the treatment itself? Will I have some issues to enter? Will I have some issues with the medication? These are some of the questions that most of the patients ask most of the times. I can tell you that no, not at all. We work with different providers around the world that can definitely send you the medication home. You can also come to Barcelona. I always tell you to come here. Let's have a chat. Let's have a meeting with the doctor. Of course, this is something that we need to consider in the time that we can do it. And if it's not possible, then it's not an issue. At least to have another video conference, to have a call. I have also many of my patients contact me on WhatsApp when they have an urgency. So this is not a problem at all. And most of the times it is something that can be really useful in case you are planning to do it, let's say, in the near future. So most of the times, let's say that what I always try to make up my patients understand, and I think all of my colleagues, is that this procedure itself, it's not difficult. Okay, it's not something that we need to feel stressed about. We will always try to make you understand everything. If we have to, let's say it in different words, with different phrases, it is not a problem at all. We know that every case is different. We know that sometimes it can be a bit complicated to organize everything that you have, your work, your studies, everything that you're doing. So do not hesitate just to let us know if you have any question or something that you'd like to know. So I would like to read a few questions that we have from the chat. I know that some of you sent us your questions beforehand. So some of the questions that can be, let's say, asked most of the times when we are having a call or that we receive an email is, for example, the potential damage. This is something that most of the times is asked, something that many patients are worried about. And let me explain you a little bit about how it definitely works. So most of the times they're worried about the hormonal stimulation and also, let's say, the surgery itself, the intervention when we go to the surgery room. And let me tell you that the hormonal stimulation is something that we most of the times do not have a general protocol for every patient. We try to we try to personalize all of our treatments. We try to make them as close as possible to your medical case. So we take into account many factors that you already can provide us, and then according to this, we can see if we can try something else. If you've already, even I have so many patients that they've already done these procedures in other countries and they'd like to try maybe in Spain or in any other country, and they are a bit hesitant about it. So we always tell them that if it already worked, maybe we can try again here in Spain to use it, maybe with another dose or maybe with another thing. This is something that a doctor can explain you much better. But most of the times, this is something that definitely can help you to feel relief and also see that we're really involved in the main idea of having the best the best results and a really successful treatment. Also, apart from that, also the surgery itself, there is no risk. There is no, of course, ideas that you can have to, let's say, attach in the mind that there is something that I need to consider. I mean, this is a general procedure that we do most of the times. Of course, as any medical procedure, there can be many things that we need to understand according to each case. Sometimes there is a bit of pain, there is sometimes some inflammation, but these are things that the doctor can definitely provide you with some medication, or maybe some exercise, or maybe some ideas of how you can do it, maybe to move a little bit to make the blood run. So there are different ways of approaching the same things. And of course, there are many ways to also think about it. There are many patients, they would like to do more sport, or they are doing some type of like yoga, or like this type of activities that sometimes can be a bit difficult to do them once you start in the treatment. So we're always trying to make this a good way to also prepare everything that we're going to do and have an idea of which is your daily life. Okay, some of the questions that also some people ask is, are frozen eggs really safe long term, and how long can they be stored? So let's get a little bit deeper into the laboratory part. Eggs, when they are frozen, they can be, let's say, stayed in that place for a really long time. They can stay in the laboratory for many years, as long as you want, of course. But we always advise you to have an idea more or less when you'd like to do the treatment, to consider it a bit. Of course, this depends on every case, it depends on every patient. And this is something that we will definitely ask you, according to the Spanish law, we need to continue have an idea of which is your purpose with this biological material. So this is something that we will always try to make it, let's say, comfortable, but also have a pace of how we can do this, how we can do that, if you have an idea of what you like to do, if not. And then in case you have any questions about when you'd like to do them, if I'm in a good age for doing it or not, then this is something that you can definitely ask whenever you desire. How long they can be stored, as I said, it's definitely something that can be up to you. As they are, let's say, frozen with something that is liquid nitrogen, this is a really safe procedure. And also in our laboratory, we use type of medium that can keep them really safe. So if you have any questions about this, you can also ask us. I think the laboratory will be pleased to give us all this information, and also to provide you with any idea in case you have any confusion, if you would like make us to give us some more information about anything regarding this part of the treatment. How many times do I have to be in Barcelona? Well, this varies. We can adapt to every case. Most of the times we always offer international patients maybe to, let's say, come to Barcelona for the procedure if they can. If they cannot, they can always start in the country, send us the results of the ultrasound and also the blood work that can be necessary during the hormonal stimulation, and then come for the last ultrasound to see that everything is okay, that we are ready, that we can, of course, schedule the egg retrieval. And then once we have this, they can definitely go home. We always advise them to stay at least the same day of the egg retrieval, and they go home the next day. But it is up to you how long would like to stay. It is not risky to travel the next day, not at all. And it is not also risky to travel when you're doing the hormonal stimulation. This is something that definitely we need to talk about with the doctor during the first consultation. Things regarding anything about your medical history and all these things for the medication. So it is not a problem to just have a better idea of how it works. Then according to your case, we can adapt to every treatment. You can be in Barcelona only for the egg retrieval and the last control. You can come for the whole treatment. You can come in the middle of the treatment. This is something that definitely patients can tell us more or less how they'd like to do, and then we can propose them a better idea of how we can do it. Okay, so following with some questions that some people also sent us is, can vitrification affect the genetic or epigenetic integrity of the eggs in any way? Well, this is a really interesting question, because most of the times people ask me if this can, let's say, make the eggs decrease their quality, even if they are really young people, or if they are a really advanced age, or even if they are trying to keep them in a really good age. This is something that it's definitely not a problem at all. Actually, the main idea of this treatment is to keep the quality, okay? And of course, this is the main objective of this is that you have better chances in the future to have a safe baby. So as this is our main objective, I can at least tell you that this is not a problem at all. It would not affect any genetic or epigenetic parameter that we can consider for a baby, or even in the pregnancy itself. So it would not decrease your chances to, let's say, become pregnant, or any chances of being of having a really good and beautiful baby. It would not be an issue at all. Okay. Then any other questions that we can get? Let's say that, well, if you would like to talk maybe about other things, send us your questions. We are really open to answer most of them. Okay, we received another one, and it's that, what are the main factors that influence egg retrieval, egg survival rates after warming? So we always like to talk about what we call a fertility funnel. Okay, this is something that most of the times many doctors explain during the consultation. But the main idea is that most of the times we can start with something really big, a really big number of follicles in every ovary. And then once we get to the final part, that it's creating embryos, we have less and less and less and less. But the main idea, as I said, is that we have really good results. At the beginning, someone asked us if which is the most important part of number of eggs that I need to have. And as I said, 15 is the, let's say, optimal scenario that we can have. But of course, it varies on every patient, it varies on the age, it varies on the things that we can see. And of course, this is something that can be different to every patient. So according to your case, we can see more or less how we can adapt this. We definitely want to have good chances. So we more or less calculate according to this how many cycles you would need. And then from 15 on, then we can see how many things we can get, how many eggs we can collect from the egg retrieval, how many of them can be frozen, and then finally how many embryos we can get from those eggs that we've already have. Okay. At what stage of the egg development is vitrification performed, and why is the timing important? Okay, so this is a really, let's say, important question. Some people ask us about, okay, but I know that I have like 25, but you just now tell me that you've already frozen 15. So to make it easy to understand, let's say that eggs have like different stages during their development. And what we are searching is what we call an M2 stage, okay? This is basically when they are what we call mature. And then if they are mature, we have the possibilities of, let's say, fertilizing them and then finally having an embryo. And if everything goes well, we can have a good involvement and also a really embryo development that can be realistic and also optimistic for your case. So the main idea is to do it when we have this stage. Of course, the main idea is that when the follicles are already grown, we have this stage of the eggs, but we cannot know it until we go to the egg retrieval, and then finally the laboratory confirms it in a microscope. Then this is really important for freezing them, because also the survival ratio is higher. And definitely, once we're going to defrost them, or we're going to throw those eggs and then fertilize them, it also increases the chances of making them survive. Okay. I don't know if someone else maybe would like to do some other questions about the time, about medication, about maybe the treatment itself, because I know that some of you can be worried about this part. As I said, There is no issue with that. Here in the clinic, we've worked with this treatment many of the times. This is something that we perform every day, okay, or almost every day. And at least I can tell you that the results are really good. The patients are really, really, really interested in knowing which are the future options. So this is something that we can always provide you with this. Okay, we have one more question. From your perspective, for those who have already gone through egg freezing, do most people feel it was worth it? Okay, um, I might need to be honest in this part, and I need to say that from my perspective, many of the patients that come to the clinic, sometimes they'll feel really hesitant about it. Some of them, they are really worried about the pressure of being in a certain moment of their lives and not knowing what to do. So most of them are really grateful that someone can clarify their options and that can at least give them a better idea of how can I do this, or why would I do it. And then it is definitely an important decision in your life. It is something that some patients take the time to reflect about. And I can say at least that most of them, once they finish the treatment, they feel relief. They feel that at least they have an insurance for a future. And of course, that even a near future or even in a midterm future, they decide to proceed with any other thing, they at least know that they have this material that they can use in the future for the project. And if finally they don't do it, at least they knew that they were able to do it without any problem. So it is important to understand that this treatment, as I said, is a really good chance to, let's say, keep your fertility in a way that you can use it in the future. The main idea of this treatment also is that as the egg quality start to decrease at some point, then we can at least enhance the possibilities in the future that this quality can remain at the moment that you did the treatment. So let's say that many of the patients, they do it also because of this. And at least I can tell you that it was worth it. It was definitely worth it. And if in the future you desire maybe just to keep going with the treatment, we will definitely be pleased that you can at least have a really good result and definitely a pregnancy and finally a baby. So in this case, I'd like to know if you are interested in knowing maybe some perspectives about the patients. I can tell you that in our social media, we've got plenty of this comments, plenty of perspective from different patients. I know that many of you have written to us in our Google reviews, also Instagram. Do not hesitate to reach us in our webpage or even to call us directly to the clinic to know more about this treatment, to know more about your chances, more about the perspective of the treatment itself. And then finally, if you have any other questions, do not hesitate to reach us. So I don't know if some of you may have any other thing to know about. It could be interesting maybe to um, encourage you to make all your questions, and then maybe we can keep talking a phone or also in a video call with the doctor. Our first consultation is totally free, no engagement. So if you are interested, let us know. Have an idea that at least for my part, if you'd like to ask myself, I will be pleased to help you out with any of your questions. And of course, we can keep talking about all of this, have a little chat. And definitely, if you ever come to Barcelona, I will feel truly grateful that to have you here. So if there are no more questions, maybe we can close the chapter today. I hope that all of you that were connected at least have really good chances and really good ideas of how this treatment works. I would like also to be grateful for the opportunity of today. And then finally, I hope to see you soon around our halls. Thank you so much.